Thank you for joining us today for the 15th Annual Prostate Cancer Awareness Day. My name is Feina Stern. I'm a physician and founder of the Admetech Foundation, the event organizer. Admetech Foundation is a nonprofit organization providing leadership for groundbreaking programs in prostate cancer at the state, national, and international level. Our programs have been transforming patient care for everyone and reducing health disparities in Black, Hispanic, and Latino men. This event is organized in collaboration with the Prostate Cancer Action Council. I'd like to express my gratitude to members of the council. Most of them are our partners for over a decade. This event is dedicated to the memory of Naak Vaisaki, my father, and Representative Stephen Kulik. My dad was a lifelong warrior for the underprivileged, older people, ethnic and racial minorities, immigrants. It is my dad's diagnosis and the subsequent journey of our family that prompted me to dedicate my career and Admetech's work to prostate cancer. It has been a labor of love. Representative Kulik was a prostate cancer survivor, champion of our program, and a host of this annual Prostate Cancer Awareness Day at the State House until his retirement a few years ago. This event is a part of my father and Representative Kulik's legacy. I hope this event and all our programs reflect, at least in part, what both my father and Representative Kulik were well known for. Very kind hearts, big enough for everyone, open and ready to help any person in need. At this 15th anniversary of our Prostate Cancer Awareness Day at the State House, I'll highlight the key landmarks of this event. In 2009, we held the first annual event. In 2010, Governor Deval Patrick issued a proclamation initiating a new transition to announce this event as the Massachusetts Prostate Cancer Awareness Day on annual basis. In 2011, in response to our advocacy, Massachusetts General Court created a historic precedent by recognizing prostate cancer as a central issue in men's health, public health priority, and leading health disparity. In 2013, with support of the Massachusetts legislative leadership, we established a prostate cancer research program with the priority focus on clinical trial of prostate MRI. At that time, no other public or private organizations, including NIH, were willing to support this technology and related research. Our trial showed a groundbreaking impact of MRI, which was accepted as a new standard of patient care less than 4 years later in early 2017. There are no blind biopsy or treatment performed today without MRI. In 2014, we initiated statewide public awareness campaign as a part of our program and established a Prostate Cancer Action Council with the focus on high-risk individuals. While prostate cancer is curable when detected early, Black, including Hispanic and Latino men, are 2.5 times more likely to die compared to white men. In 2016, we added medical education to our program when we held the first annual global summit on precision diagnosis and treatment of prostate cancer. Unlike other educational events, which are based primarily on a single clinical subspecialty, our summit brought together the key international opinion leaders representing every clinical field involved in patient care. This summit stimulated a cross-disciplinary dialogue and has been widely recognized as having a seminal impact on medical education, best emerging clinical practices, and research priorities. Our summit has been instrumental in expediting pioneering research and radiomics, including our own, in integrating information from imaging and genetic testing for precision diagnosis and care. More recently, we expanded the field of radiomics into multi-omics by integrating imaging and genetics with other diagnostic tools. In 2022, we launched Prostate Cancer Equity Program jointly with UMass, Mass General Brigham, NAACP, and Latino Health Insurance Program to expedite access of Massachusetts men to the best patient care available today and support them every step of the medical journey. This program is open to any Massachusetts men age 40 and older, and our priority focus is on Black, including Hispanic and Latino men who are at higher risk of poor quality care and death. We'll discuss this program later. 1 year ago in 2023, based on our summit recommendations, we established an international working group to expedite transition of minimally invasive focal treatment of prostate cancer from the current research phase to a new standard of care to improve men's quality of life and reduce healthcare costs. I'll describe this effort later in more detail. I'd like to thank our team, including our event host and long-term champions, Senate President Pro Tempore William Brownsberger and Representative Jerry Cassidy, Admetech staff members Thomas Satem and Emma Coyard, our outstanding Boston College interns Daniel Adonisio, Emily Mao, and Julie Satterswade, event managers Nancy Petkunas and Josh Garneau, and technical support led by John Sutherland. Finally, I'd like to acknowledge our sponsors who made this event possible. We are proud to be supported by global leaders in prostate cancer research and care, including Lantheus, Astellas, Blue Earth, and Johnson & Johnson. Again, welcome to our 15th annual Prostate Cancer Awareness Day. It is my pleasure to introduce our first speaker, Jordan Rich, member of the board, Massachusetts Prostate Cancer Coalition.
Hi there, this is Jordan Rich, host of the MPCC podcast series, Prostate Cancer and You. I'm here to extend a warm welcome to all of you from the Massachusetts Prostate Cancer Coalition. MPCC is so proud to be a longtime partner with Admetech Foundation in organizing and promoting the annual Prostate Cancer Awareness Day. It's always a productive and exciting day because it showcases the strong support that all of us in the prostate cancer community receive from the Commonwealth of Massachusetts as we continue to educate, support, and offer key resources and connections for men at risk, diagnosed individuals, survivors, and their families. We're working hard to bring together organizations and professionals in Massachusetts, all of whom share in a common goal: to improve knowledge, reduce prostate cancer healthcare disparities, and improve access to care. We invite you to visit our website, masspcc.org, for resources such as support groups, the latest in prostate cancer research and treatments, our informative podcast series, news about the upcoming symposium on May 17th, and a whole lot more. Once again, we express our thanks to Admetech for organizing this annual Prostate Cancer Awareness Day and for inviting us to participate. There have been a lot of advances in the diagnosis, treatment, and understanding of this disease, but there's still a lot of work to be done. The MPCC is proud to be part of these ongoing efforts. Thank you.
It's a pleasure for me to introduce Thomas Satem, Director of Operations and Health Policy at Admetech Foundation. He will be my co-MC at this event. Thomas.
Hi, Dr. Stern. It's an honor to be your co-MC for this event, especially as somebody that's worked behind the scenes the last few years. An honor. Introducing our next speaker is a long-term partner of Admetech. We're going to be introducing Lamont Scott, Program Director of Men's Color Health Awareness, MOCA.
Good afternoon, everyone. My name is Lamont Scott. I'm the MOCA Project Director. And also I have my right hand with me, Brother Al. He's our lead facilitator. And I'm also one of the top men that do a lot of the prostate cancer presentation. So today, I just want to say thank you for giving us the opportunity to speak a little bit about the work we've been doing in Springfield. So for the last several months, we've been giving out a lot of information pertaining to prostate cancer. We're setting up some venues coming up with the Vietnamese community and going back into our own community in Black and Brown and Latino men to just give them more information pertaining to prostate cancer. These last few months, because a couple of our men that have had some success by going through some of the programs that you've offered through Admetech, to come up there and visit doctors and put them on the right path of understanding more about prostate cancer. And also and we have another guy that we spoke on a little while back that's also been doing getting checked out for prostate cancer and also doing very well at this point in time, my understanding. But right now, our main focus is getting back in the community, focusing with men to be part of this session so that they will have more information through the State House and information from doctors about prostate cancer and what we can do and the success, what challenges there are, and also what men can do. With MOCA right now, we're looking a little bit more about more information, updated information that we could share, but probably data would help a lot. What's been going on in Western Mass, what's been going on in Massachusetts in general, and how we can have more success and have men have more understanding that if they're going through anything pertaining to prostate cancer, there are outlets, there are support networks throughout our community, and also in Boston through Admetech that we can rely on to get us to the doctor. With that, I'm going to say I'll pass it to Brother Al, and I'll follow back up as we move forward. Brother Al?
Thank you. My name is Brother Al. I'm with the Men of Color Health Awareness called MOCA down here in the Western Mass part of the state. Our job is to be the vehicle to bring information and awareness to our community about prostate. We want to thank Admetech for allowing us to be a voice in the wilderness, trying to keep the information coming that men would take charge of their health and go to their doctors. We know that 3 to 4 men will be diagnosed throughout the year with prostate cancer. We know that prostate cancer is a silent killer. Over the years have taken a lot of lives because of the lack of information that is being provided in the community to African-American men and Latino brothers who we target. But we also have target just in general. Men need to go to the doctor and take charge of their health. That is so important. What made me come along to MOCA was just that, taking charge of my health. And then 2015, we started talking about prostate cancer. And I went to the doctor and I came up with the slogan that it's not the finger that's killing you, it's the cancer. And then when we brought that to the faith-based community and several other community centers to let them know that we got to look past the stigma of the African-American experience throughout the years of, the medical field is not pleasant to us, and it's been passed down generations that they don't go to the doctors. We don't go. And I always hear my Uncle Willie talking about him having high blood pressure and him having problems of eating or trying to sleep at night. That's what made me take charge when I went to the doctor and the doctor told me, you need to get your prostate checked. And we know it's not just that one variety of the digital, but also taking it a real good look at the whole prostate area, that you can't just take one scenario. There's other options that we can offer our community of men to let them know that their health is important. And it's so great to know that there's information that MOCA pushing out in the community for over a lot of years. Bringing health awareness to our community is so important. And we're just grateful to know that the African-American men will die, but survival if we get to the doctors. And we have a variety of men who have gone through our program, who have had their prostate checked, and we have a couple of survivors, and they help us carry this message is so important.
Thank you, Brother Al. Also, Brother Al did mention because of the MRIs that we can do now, they can get a better picture and better view of the prostate, which is so important. It is not invasive. So we're just looking for more information to give men a little more peace of mind. So when they go to the doctor, or if they haven't been checked, or if there are any history within their family, especially with Black and Latino men that are in the age around 40, we want them to go out there and get checked. We know that we do have a lot of mistrust in doctors. We're trying to get past that. But we continue to work with other community hospitals like Mercy Hospital, Bay State Hospital, which we just not long ago did out one of our health fairs with Bay State, and we're also participating in some of their health projects moving forward. So it will allow us to continue to network with men on the platform of which one of our priorities is prostate, but all the other health disparities that may be affecting us as we move forward through life. Thank you for allowing us. I want to thank Dr. Stern, Thomas, Emma, and the whole team up there that's been giving us the support that we need to continue to do the work here so they can understand what's necessary to provide and how to continue to go see their doctors and then information of prostate cancer.
Thank you, Lamont and Brother Al. We greatly appreciate it. Before getting to our next speaker, we have a few legislators in attendance. I would want to thank Representative Giannino, Representative Kushmerek, Senator Kennedy, and the office of Representative Balzer. We thank you for attending this event and being great supporters of our program. I do ask the legislators that are watching if you could make, or offices of the legislators make comments in the Facebook Live comment, and we'll be able to make sure that you're publicly acknowledged. Introducing our next speaker is going to be Dalton Scarrett, President for the Center of Health and Social Inequities and Disparities. Dalton.
A pleasant greeting to all who are with us today. I'm from the Center for the Elimination of Health and Social Inequities and Disparities, Inc. My name is Dalton Scarrett, and welcome to all who are with us just partaking in this event, which is the annual Prostate Cancer Awareness Day this year, 2024. We're just very happy that we're able to have this event where we could drive the awareness and the importance of having prostate cancer awareness throughout our community and across the Commonwealth of Massachusetts. Today I'll be going over a few things which show the type of work that we do in the community and how important it is. Without Admetech Foundation, I don't know how much of this work would have been done throughout the entire Massachusetts. As soon as Admetech came on the scene, that they took the initiative and from ever since have been carrying the torch. CECID also a pretty significant work that has been done throughout the greater Boston area and across Massachusetts in terms of eliminating disparities. Is very vibrant still in terms of men's health and prostate cancer and the awareness. What we bring to the table is a full array of workshops and curriculums based around care coordination, patient navigation, things that strengthen the healthcare delivery system and the front line of the healthcare delivery system, which is the community health centers. So we're able to, support the community health centers in terms of getting men from the various communities to their community health center. And that is through a technique which we call the man cave of the healthcare delivery system. That is the point of contact where you meet men in the community and you make them so comfortable that they now acclimate to the healthcare system. A lot of men are not too, I would say, cozy with the healthcare system, and many access the healthcare system through the emergency room. So what we came up with, which is CECID, C-E-H-S-I-D, Center for the Elimination of Health and Social Inequities and Disparities, Inc., is to develop programs that help men to understand the concept of utilizing healthcare the proper way, which would be through your front line rather than waiting and accessing from the emergency care or urgent care, which is much more costly. And by that time, a lot of damage has been done. So in terms of prostate cancer specifically, what we're seeing is early detection, early diagnosis. That is very critical. But in order to achieve that, you need agencies like the Admetech, CECID, MOCA, various men's health movement and programming that would reach men and educate them on the process of acquiring health insurance first. If you have no health insurance, which you should have in Massachusetts, is the law, then it makes it difficult to access, the healthcare resources that's available at some of the best hospitals in the world and some of the best health clinics that's right here in Massachusetts, which we have about 50 health centers we have in Massachusetts, 49 to 50 at a given time. They're all available for us to use. Men in our communities could live within close proximity to a health center and never access that health center. They have access to other professionals that's involved with what we do at CECID, and an array of doctors that they could reach out to in the community that will give them the information and give them the treatment, and especially, can't emphasize enough, getting screened early for prostate cancer as early as 40 years old or so. Perhaps you have family history where there is maybe, what you're looking at the array here, where there is prostate running in the family and it comes in at an earlier age, has been pushed for many years, or 50 years, for a matter of fact, that was being pushed for many years. But case by case, each individual is different based on their family history, their risk, and as we see, if you're African American, your risk is extremely high. And we take time to celebrate this year where we are saying today we're declaring it Prostate Cancer Awareness Day. And we're very thankful to Admetech Foundation, all the lawmakers, all the politicians, everyone that has been very vibrant in this move to make sure men are getting screened and research is taking place to advance the ability to diagnose and detect prostate cancer at a very early stage, and also lifestyle changes that we can do in terms of diet and other things. So we're very grateful for the opportunity today to be part of this great day at the State House to push forward the awareness of prostate cancer. And thanks again to Admetech Foundation and all the other agencies from all across the Commonwealth of Massachusetts. And that's from CECID, which is the Center for the Elimination of Health and Social Inequities and Disparities, Inc. CEHSID.org if you are interested in finding out more, and we're here for the community. Again, thanks everyone for being part of this great day.
Thank you so much, Dalton. Right now we have messages from our sponsors, please.
Hank's always got his tool belt with him. Now Hank is living with prostate cancer. He still knows how to be handy. And he also knows once daily Xtandi. Xtandi treats metastatic prostate cancer that responds to a medical or surgical treatment to lower testosterone. Xtandi is proven to help these men live longer. Xtandi may cause serious side effects, including seizure, a brain condition called PRES, allergic reactions, heart disease that can lead to death, falls, and bone fractures. Stop taking Xtandi and get medical help at once if your face, tongue, lip, or throat start swelling. Tell your doctor at once if you faint, have a seizure, quickly worsening headache, decreased alertness, confusion, vision problems, chest pain or discomfort, or shortness of breath. Xtandi can cause harm to an unborn baby or miscarriage. Most common side effects include muscle and joint pain, feeling unusually tired, hot flashes, constipation, less appetite, diarrhea, high blood pressure, bleeding, falls, fractures, and headache. Nice work, Hank. Ask your doctor about Xtandi.
When it comes to optimizing cancer care, improving the lives of patients through innovative imaging solutions is critical. Blue Earth Diagnostics is empowering the evolution of care for patients with cancer.
Thank you. I would like to open a formal program, and it is a great pleasure for me to introduce two long-term champions of prostate cancer program in Massachusetts. Senate President Pro Tempore William Brownsberger, who represents Belmont, Watertown, Boston. Senator Brownsberger is the event host and was instrumental in establishing a statewide prostate cancer program since 2013. Representative Jerry Cassidy, Joint Committee on Veteran and Federal Affairs. Rep. Cassidy is the leading champion of the prostate cancer program statewide and at Brockton, Plymouth County since his election in 2015.
Thank you. So I'm Will Brownsberger, and I'm with Representative Cassidy. And we're both pleased to support your wonderful efforts on this issue, the efforts of Admetech and you personally, Faina. And we're going to jointly present a resolution. This resolution, what you see is the resolution that was adopted last year. And the resolution that we're going to read right now is going to be adopted by the Senate today and shortly thereafter by the House. It's already been co-sponsored by a total of 20 senators and 74 representatives. And I will begin the reading and we will do this in partnership.
Thank you, Senator.
So these are resolutions commending the Admetech Foundation on recognizing the 15th Annual Prostate Cancer Awareness Day on March 28, 2024.
Whereas prostate cancer is a public health crisis, central issue in men's health and leading healthcare disparity in Black and Hispanic men in the Commonwealth.
And whereas according to the American Cancer Society, prostate cancer will strike over 6,420 men and take the lives of 700 men in the Commonwealth in 2024. And
whereas early detection of lethal prostate cancer is critical for saving lives and research on development of novel procession approaches to screening, diagnosis, and treatment are essential for individuals, high quality patient care, and for saving millions of dollars a year in healthcare costs in the Commonwealth.
And whereas the Admetech Foundation has established a prostate cancer action council, which includes the American Cancer Society Cancer Action Network of New England, the Center for Elimination of the Health and Social Inequities and Disparities, the Latino Health Insurance Program, Inc., the Massachusetts Prostate Cancer Coalition, Inc., the Men of Color Health Awareness, the National Association for the Advancement of Colored People of New England Area Conference, and an independent blue ribbon expert panel representing leading hospitals and experts to create, the goal of all these people working together is to create a new model of national and global leadership in improving patient care and health equity by integrating research with medical education and public awareness. Now, therefore, be it resolved that the Massachusetts Senate, and this ultimate resolution will include the House, hereby commends the Admetech Foundation for recognizing the 15th Annual Prostate Cancer Awareness Day on March 28, 2024, and extends its sincerest appreciation to the Admetech Foundation for their continuous dedication to saving lives, improving the standard of care, and ending prostate cancer as a public health crisis and a leading health disparity. And be it further
resolved that a copy of these resolutions be transmitted forthwith by the Clerk of the Senate to the Admetech Foundation.
So that's our joint resolution. Representative Cassidy and I are pleased to be working together to support your wonderful work. And back to you.
Thank you so much, Will and Jerry. Thank you.
Introducing our next speaker is going to be a long-term supporter of addressing healthcare disparities in prostate cancer statewide in the greater Springfield area. Introducing Representative Carlos Gonzalez, Chair, Joint Committee on Public Safety and Homeland Security in the immediate past, Chair of the Massachusetts Legislative Black and Latino Caucus. Representative Gonzalez.
Good morning, and thank you all for the great work that you've continued to do. As rookie representative, I was introduced to the programs that you were providing and the importance of the outcomes that were being received, particularly in the city of Springfield, with the great work of the greater men that were doing the work here in the city of Springfield. So thank you all for joining us today and coming together to recognize Prostate Cancer Awareness Month. Kudos and salute to Chairman Cassidy and Senator Brownsberger for the presentation today, as well as the great work and contributions that the Speaker of the House has made to this effort, and also our Senate President, Spilka. I'm gonna go into the statistics, but I will just say that take a moment to acknowledge the tremendous impact that Dr. Faina Stern, President and CEO of Admetech Foundation, has made in our community, particularly here in the city of Springfield, with the great work of all those responsible for delivering the effective information necessary. But Dr. Stern, dedication and tireless efforts have provided invaluable information and support to diverse communities across Massachusetts. And ultimately, that has saved lives. And through her leadership at the Admetech Foundation, the work that her and her team has worked tirelessly to bridge the gap in healthcare access and education. And I think that's important. The education is the key. A lot of people, including myself, weren't fully aware of the importance of prostate testing. Her commitment to providing diverse communities with this knowledge and resources they need to protect themselves from prostate cancer is truly commendable. And I think the resolution today highlights that effort. I would like to also extend my gratitude to the great work of the team in Springfield for their great work, including my colleagues in the delegation, Bud Williams, Orlando Ramos, representatives, Angelo Pupolo, Brian Ash, as well as Senator Adam Gomez and Senator Jake Oliveras. As we observe Prostate Cancer Awareness Month, let us remember the importance of early detection. And I think that's what one of the key educational components that I receive, the importance of early detection and also regular screenings. Maybe we should do a screening at the State House for all the elected officials at some point. And maybe we can help rid this disease that's impacting our communities in more ways than one. Together, we can continue to raise awareness and support those affected by prostate cancer. So thank you for the great work and dedication to this cause, and I look forward to continue working with you as we move forward in this budget, but also in the budgets to come.
Thank you so much, Carlos. Thank you so much for your years of support. It is with great pleasure I'd like to introduce our next speakers, Her Excellency, Massachusetts Governor Maura Healey.
Hi, everyone. Today is the 15th annual Prostate Cancer Awareness Day. Thank you to the Prostate Cancer Awareness Council, community organizations, and our world-class clinical institutions for bringing us together. As many as 1 in 8 men and 1 in 6 Black men will be diagnosed with prostate cancer during their lifetime. The American Cancer Society estimates that 6,400 men in Massachusetts will be diagnosed this year. While prostate cancer is curable when detected early, 700 men in our state will lose their lives, with Black men being 2.2 times more likely to die from this horrible disease. This is a central issue in men's health and in health equity. And so I'm grateful to all of you and to our top-notch medical community for taking it head on. Because of your work, cutting-edge advances in screening, diagnoses, and treatment happening in our world-class hospitals are better reaching our communities. But we still got work to do to expand our leadership in prostate cancer awareness, education, research, and care. I'm so glad that this team is on it and want to be partners in this work. Thank you for all that you are doing to help our residents stay healthy.
Thank you to Governor Healey. Our next speaker, I am honored to introduce is Senate President Karen Spilka.
Hello, I'm Massachusetts Senate President Karen Spilka. I'm glad to be with you virtually to say thank you for your commitment to this issue. In particular, I'd like to commend my friend and Senate President Pro Tem William Brownsberger and Representative Jerry Cassidy for bringing this incredible group of people together and putting on a remarkable program. I'd also like to thank the Admetech Foundation and the Prostate Cancer Action Council for organizing the day. Far too many men and their families bear the burden of pain and hardship this disease can bring. But your work is really making a difference. About 300,000 men in the country will be diagnosed with prostate cancer just this year alone. That's about 1 in every 8 husbands, dads, granddads, sons, fathers, and friends. About 6 of every 10 of them will be over 65 years old. And more often, those men will be African American, who will also typically be diagnosed earlier on in their life. Of every man diagnosed with prostate cancer, about 35,000 will pass away from it. That's about 1 in every 44 men. The good news is, though, that we know what we need to do, and we cannot say it enough. Build awareness and spread it far and wide. We need to be shouting from the rooftops to say that every man should be screened, because 99% who are screened and diagnosed with early stage prostate cancer will live. That's 99% of husbands, dads, granddads, sons, fathers, friends. The survival rate has been on a steady incline for the past 20 years. That progress is a direct result of building awareness that getting screened, getting a mammogram, is easy and may save your life. And that's why I'm so grateful you are here today, and why I'm proud that the Senate and the legislature supported Admetech's mission of awareness, education, and research in the fiscal year 2024 budget. We need to spread that message until every man is screened early and often, and until our communities of color get the equitable access to screening and care that they deserve. Alongside those efforts, we're going to keep working to make sure Massachusetts remains the center of global biomedical research and innovation, and builds a strong nursing, education, and healthcare workforce that continue to provide world-class care to people in treatment and recovery, so every individual has the same opportunity to live a long and healthy life. Thank you again so much for all that you do to ensure a healthy future for the men of Massachusetts. Be well and take good care.
Thank you. Thank to Senate President. Our next speaker, who is, I'm also very proud to introduce, is Speaker of the House Ronald Mariano and Senate President Karen Spilka, who were the first in the nation to announce prostate cancer program, prostate cancer research, prostate cancer awareness as their legislative priorities in the state.
Hi everyone, this is Speaker Ron Mariano. I want to thank the entire team at Admetech for putting this event together for the 15th Annual Prostate Cancer Awareness Day. I would also like to thank the Prostate Cancer Action Council for putting this event together. During the early part of my speakership, so much of the work that we did in the House was about recognizing the disproportionate impact that the pandemic has had on our society, so that we could build back stronger than ever. Due to the many underlying racial inequities that exist throughout our society, we have worked hard to ensure that our recovery efforts are carried out fairly. Unfortunately, many of these same inequities can also be found in the fight against prostate cancer. As you all know, prostate cancer strikes 1 in 9 men. Even worse, Black and Latino men are 2.5 times more likely to die from prostate cancer than white men. Because of these troubling statistics, I am grateful for the work that Admetech does. The House has been proud to work alongside Admetech to promote awareness, education, and research. That's why the legislature has allocated millions of dollars towards funding for prostate cancer research. Through your advocacy work, Admetech recognizes that the way to make progress on this issue is to detect and treat prostate cancer early on. Specifically, the work that Admetech does to spread awareness about those who are more likely to develop prostate cancer is absolutely critical. While we can all do our part by talking with your doctor about getting screened for prostate cancer, the House will continue to do its part by legislating with the racial and health disparities in mind. I know that the House is committed to working with partners like Admetech to do our part in helping to spread awareness and to curtail the damage done by prostate cancer. So thank you again for including me in this discussion. I'm grateful for the efforts being made by so many of you. Thank you all.
Our next speaker is Senate Majority Leader Cynthia Cream. Thank you, Speaker Mariano.
It's a pleasure to join you for the 15th Annual Prostate Cancer Awareness Day. Thank you, Dr. Fainer-Stern, for inviting me and for your tireless efforts to make prostate cancer a public health policy. The Foundation has been a leader in every facet of improving prostate cancer in Massachusetts, as well as around the world. Its research has dramatically improved diagnostic and therapeutic tools. Its educational programming teaches thousands of providers about best practices for prostate cancer care. And its outreach efforts target communities with the highest rates of prostate cancer mortality, increasing awareness and improving access to care. Thanks to this comprehensive approach to prostate cancer care, the Admetech Foundation is saving countless lives every year. And with all of our support, it will continue to save lives. I'm so proud to support the Foundation's work, and I'm in awe of all that you have accomplished. Thank you again for asking me to join you today.
The next speaker we have is Senate Majority Whip Michael Rush, who serves as a commander of the U.S. Navy in the Reserve Corps and represents Boston in Suffolk County and Dedham, Norwood, and Westwood in Norfolk County. Senator Rush is a leading champion of the prostate cancer program since its beginning in 2013. Senator Rush, please.
Senator Mike Rush of the Norfolk and Suffolk District. Happy to be here once again for the 15th Annual Prostate Cancer Awareness event. I'd like to thank Dr. Stern and the Admetech Foundation for including me in today's program and for being a global leader in the fight against prostate cancer. Prostate cancer accounts for 1/8 of all new cancers diagnosed in men and is the leading cause of cancer death amongst men. It also treatable, can be caught and treated early. Unfortunately, many of those who may develop prostate cancer are unable or unlikely to receive the screening and treatments that would mitigate the worst of the disease. The fight against prostate cancer is a racial justice issue. Black men are 73% more likely to develop prostate cancer than the general population. It is a veterans issue, as veterans are nearly twice as likely to develop prostate cancer as the general population. These are communities which have historically been underserved by the medical fields, in which the Commonwealth has time and time again committed to addressing the inequities in their care. There is hope in the fight. Through events like this and through programs like those championed by Admetech, we are slowly but surely raising awareness and expanding access to those who most need it. Once more, I'd like to thank the team at Admetech for their advocacy, as well as all of you for joining us today for your contribution in the fight against prostate cancer. Thank you.
Senator Rush, we greatly appreciate it. Before we introduce our next speaker, we have a few offices that we want to acknowledge publicly. Representative Garlick's office, Representative Garbley, Representative Cabral's office, Representative Ferguson's office, Senator Edwards' office, Senator Crichton's office, Representative Burrows, Representative Vargas, and Representative Saunders. We want to thank you for attending today's event, and we greatly appreciate your support. Our next speaker will for this event is Senator Pavel Payano, Chair, Community Development and Small Business, and leader of healthcare equity programs in Massachusetts. Senator Payano.
My name is Pavel Payano, and I am the state senator representing the 1st Essex District, comprised of the communities of Lawrence, Methuen, and Haverhill. I am proud to speak today in support of the Admetech project, their research for early detection for prostate cancer, and the work they've done across Massachusetts has been invaluable in spreading awareness for men's health. Admetech has previously worked closely with the Massachusetts State Senate to secure funding for prostate cancer prevention and awareness, especially amongst BIPOC communities. I look forward to supporting them in the upcoming FY25 budget process. 13% of men in America will suffer from prostate cancer at some point in their life. It was the second most commonly diagnosed cancer in Massachusetts since 2014. Despite being curable with early detection and declining mortality rate over the past 10 years, it remains the second most lethal cancer for men in Massachusetts. Black and brown men are at a higher risk of developing prostate cancer due to a history of systemic inequality and a lack of access to quality health care. Black men in particular are 2.5 times more likely to be diagnosed with prostate cancer than white men. On an individual and an institutional level, Black and brown communities do not have access to the same level of unbiased preventative care as others in Massachusetts. This is why we need organizations like our Admetech to help overcome these disparities in men's health and promote early detection research for prostate cancer. As someone who lost a family member due to prostate cancer, I am proud to support their continued research and encourage them to work closely with communities like Lawrence, Methuen, and Haverhill to create a healthier future for all individuals. Thank you.
Thank you, Senator Payano. Our next speaker is Representative Marjorie Decker, Chairperson, Joint Committee on Public Health.
Good morning. I want to thank Dr. Chatern and Admetech for convening this event to address the staggering disparity in the U.S. with regards to prostate cancer. As we know, prostate cancer is the second leading cause of death of cancer of men in the U.S., and we know it more adversely affects people of color. What I appreciate about Admetech's work is that it both challenges us to address the staggering statistics about diagnosis and treatment. And as we know, communities of color are disproportionately affected, facing higher incident rates and adverse outcomes. As Chair of Public Health, understanding the systemic impact of racism in our healthcare system is really important to all of us. It's our responsibility as policy leaders to address the inequity in health outcomes by intentionally investing in more resources to do both the prevention and the treatment. Black men are almost twice as likely to be diagnosed with prostate cancer than white men, and almost twice as likely to die. It's important that we understand this is the consequence of systemic racism in our healthcare system. There's nothing inevitable about men of color dying at twice the rate of white men who have prostate cancer. In partnership with Admetech, the legislature has understood this and acted to respond with the urgency required. I want to thank Speaker Mariano and my colleagues, many of whom you'll hear from today, who understand that budget and policy choices give us the opportunities to change these outcomes and to directly address systemic racism and inequities in health outcomes. These statistics are often based on factors that, again, are not inevitable. It's about the high costs and access to healthcare, compounded by the lack of culturally competent providers in our healthcare system. As a result, fewer Black men are unable to access prostate cancer screenings, and without a diagnosis, one cannot begin early treatment. And we know early detection saves lives. Lower tax revenues than predicted triggered a round recently of 9C cuts by the administration. This will continue to be a concern as we move to debate and negotiate the FY25 budget in the House and the Senate. This reality calls on all of us to be more intentional in understanding the impact of communities, the impact on communities that are a direct result of inequity and structural racism. And while I'm really pleased to see the Department of Public Health's recent announcement launching a new health equity plan to address racism as a serious public health threat, this new health equity plan will be most effective if it makes a difference in the lens we use to make both budget choices and cuts moving forward. Like Admetech, many organizations were impacted by the latest round of 9C cuts, losing half the funding that the legislature had previously committed. As a legislator from Cambridge and chair of public health, I want to tell you I continue to appreciate and I'm deeply grateful for the work that you do. I'm here with you in partnership and as a public health leader, and I'm honored to be part of this program today, and thank you for the work you do.
Before we introduce our next speaker, we have a couple more offices to acknowledge. Representative Wynn, Representative Madero, Representative Owens, we want to thank you for your support for this event. Next speaker introducing is Representative Bud Williams, Chair, Joint Committee on Racial Equity, Civil Rights, Inclusion, and the current chair of the Massachusetts Legislative Black and Latino Caucus. Representative Williams.
Thank you, Tom. First of all, good morning to each and every one of you, and want to thank each and every individual who's participated in this very, very important day today. Dr. Stern, I tip my hat off to you for the great and amazing work you continue to do in the steps on the heels of your father. So happy that Admetech does exist, because you've made life much better in the Commonwealth of Massachusetts. Also to the men of MOCA, part of my posse in Springfield, Springfield Black COVID Coalition, who continue to work on health issues. Bishop Talbot Swan at NAACP, who hosts those great prostate events, and we do that prostate breakfast. And also to Speaker Mariano and Senate President Karen Spica for their leadership in terms of recognizing how important this issue is. I would like to thank Admetech for inviting me to the 15th Annual Prostate Cancer Awareness Day. This year, 2024, brings with it continued challenges concerning prostate cancer and its efforts of men in Massachusetts. As chair of both the Joint Committee on Racial Equity, Civil Rights, and Inclusion and the Massachusetts Legislative Black and Latino Caucus, I am proud to be part of our state legislature that has set up a historical precedent and recognized prostate cancer as a public health priority in all men and leading healthcare disparity in Black men. In Hampden County, which I live, in my district, prostate cancer facts are unacceptable. According to the latest data from the National Cancer Institute, Hampden County leads the state. Hampden County leads the state in prostate cancer mortality in Black and Hispanic men. Unacceptable. In our state, Black men are more than twice as likely to die of prostate cancer compared to white men. This loss of our men are particularly unacceptable because early detection can save lives. Get that screening done. According to the Massachusetts Cancer Fact Sheet of Hampden County has a 101.59.7 incident and mortality rating, which is the higher rating in Massachusetts. Important to also mention the National Cancer Institute is that Hampden County has 26% of prostate cancer cases that are in the late stage. Furthermore, prostate cancer was also the leading cause of cancer deaths in Black non-Hispanic men, the second leading cause of cancer deaths in white non-Hispanic, and the sixth among Asian non-Hispanic men. To deal with this, and we're going to see a lot on this, we're going to get really involved. I have an important call to action for all Massachusetts men aged 40 and older, particularly Black men. Contact Admetech. I want to conclude by thanking Dr. Stern for your amazing work and your total commitment to leveling the playing field in the Commonwealth of Massachusetts. Thank you.
Thank you, Representative Williams. We will always appreciate your support over the years and you championing this effort as well. Introducing our next speaker is going to be Representative Russell Holmes, Vice Chair, House Committee on Operations, Facilities, and Security, and a long-term leader on equal rights, including health equity. Representative Holmes.
Thank you. I too want to join the chorus of folks. I have the pleasure to follow our chairman, Bud Williams, but also our former chair, Carlos Gonzalez, and Senator Payano, and really just saying from a priority of just all of us, the three of us, as either the current chair of the Black and Latino Caucus or former chair, as myself and Representative Gonzalez, because we understand the importance for the Black and Brown communities. And so I wanted to say congratulations for the 15 years, Dr. Stern. I can recall meeting your father at the State House and the impact and importance that he brought to this issue. But the thing that I've heard so much today is that you can hear that you have support throughout the entire building. From those who have been here from the beginning and those who've joined even later as they've joined the House and the Senate, we all have been clear on our recognition of the importance of getting around the root of the issue, as you heard the speaker say, around making sure health equity be a core of all we do. I will simply just say here at the end, it is just so important that we continue to be folks who amplify the voices of the folks I've heard even in the many organizations today. I remember being in some of those initial meetings, Dr. Stern, with you at some churches, and it was the initial meetings at Concord Baptist and others. And now to hear there's so many organizations today, Black and Brown organizations, out here speaking for themselves. Not us as legislators saying this is very important, but them saying we've had the experience of working with Admetech, working with building up our own organizations so we can get this message in barbershops and churches and all the other places that we, Black men, Hispanic men, need to get to the doctor. Now, and this is not just an impact around a prostate. Getting us to the doctor help us in all the other things, high blood pressure, and all the other reasons why we should be at our positions. And so, thank you, congratulations, and wishing you many, many more years to come.
We appreciate your support. As long as I remember my visits to the State House, it is as long as I remember your support. Thank you so much. Our next section of the program is dedicated to prostate cancer equity program, high quality care for all. And I will describe briefly our prostate cancer equity program. Doctors Kvoktin Trink of Mass General Brigham, Dr. Mitchell Sokolov of UMass Memorial, and Dr. Sean Wason of Beth Israel Lehi, our clinical partners, will describe recent advances in clinical care and research. The focus of my talk is on a prostate cancer equity program launched 2 years ago to bring these advances in patient care to every man in Massachusetts and eliminate health disparities. Prostate cancer equity program is an integral part of the Admetech's ongoing statewide program in prostate cancer that created a Massachusetts model of national leadership in public awareness, medical education and research, and clinical care equity. We are grateful to President Spilka, Speaker Mariano, and many other Massachusetts legislators who made this program possible. Our primary focus is on high-risk men, Black, Hispanic, and Latino individuals, and men with family history of prostate cancer and increasing age, 50 and older. This program was initiated since 2013 in collaboration with multiple organizations and has 4 components: public awareness, community education, prostate cancer equity and clinical care, medical education, and research. Our public awareness campaign, community education and outreach, is focused on the most vulnerable and underserved individuals. Since January 2023, we reached over 15,000 underprivileged individuals. This is a 50% increase compared to what we reported last year. Since 2019, our public awareness and education program reached over 52,000 people. For public awareness and education, our messaging is centered on the importance of screening and early detection critical for saving lives. Early detection is particularly important for Black, including Hispanic men, who are 2.5 times more likely to die compared to white men. With early detection of prostate cancer, every man is alive in 5 years. In sharp contrast, with late diagnosis, when cancer is spread to other organs, only 28% of men remain alive at the same time. The center of our medical education is Admetech's annual Global Summit on Precision Diagnosis and Treatment of Prostate Cancer. The latest 7th annual conference took place in September last year. Our summit has been recognized as a seminal event in shaping the state-of-the-art and future vision for patient care. Our summit brings together the key international experts representing every clinical expertise to review the best emerging clinical practices and research priorities. Last September, we had over 300 physicians participating. This represents a 50% increase compared to previous years, largely due to our international organizing committee established last year. This committee significantly increased participation from Central and South America, Middle East and Africa, India, and Eastern Europe, in addition to Australia, New Zealand, Japan, China, Western Europe, and North America. Since 2019, Grand Rounds in Urology serves as our media partner, publishing over 60 scientific presentations and reaching over 15,000 physicians after the event annually. Since 2021, Summit has been extensively covered by Urology Today, reaching over 35,000 physicians across the globe. It's difficult to find any corner of the world that has not been reached by this event. International Organizing Committee is chaired by Dr. Raja Kohli, a legendary professor of urology at American University of Beirut in Lebanon. Dr. Kohli worked with Admetech to bring together outstanding members, including Doctors Saad Al-Dasari Kuwait, Nibras Al-Hamdani and Usama Al-Naziri, Iraq, Khalid Al-Rumeli, Qatar, Daria Balbay, Turkey, Carlos Buchpigel, Brazil, Juan Galvez and Ray Manekop, Colombia, Michel Jabour, Lebanon, Nathan Lorenchuk and Philip Stricker, Australia, David Margel, Israel, Raluca Mititelu, Romania, Ahmed Morsi, Egypt, Vedant Murthy, India, Denny Rabah, Saudi Arabia, Rabli Redwayne, Morocco, Mike Satege, South Africa, Mohammed Shahed, United Arab Emirates, and Jordan. Over the last several years, the summit showed that our country, including Massachusetts, is running behind Western Europe in research in clinical use of minimally invasive focal treatment of prostate cancer. 1 year ago, in 2023, we established an international working group to expedite transition of minimally invasive treatment of prostate cancer from laboratories to clinics. Focal treatment of prostate cancer can be compared with minimally invasive lumpectomies for women with breast cancer, or only a partial removal of the breast that replaced a radical surgery in most women over the last several decades. Similarly to women with breast cancer, minimally invasive treatment of prostate cancer is expected to replace radical surgery in many men and can be performed in outpatient clinics with significantly reduced discomfort and complications for men and reduced healthcare costs. We expect that focal treatment may become a part of standard care in 3 to 5 years. In Massachusetts, at least 1,600 men will benefit from these procedures per annum short term, with cost savings of at least $40 million in procedures alone compared to radical surgery, conservatively estimated. Our summit showed that equal access to high-quality care is the key factor in improving patient outcomes for all men and eliminating health disparities in Black men. It is particularly important now, with so many novel diagnostics and therapeutic approaches ensuring high-quality, personalized, precision patient care. Without equal access to these advances in patient care, we will see a widening gap in health inequalities, including survival and mortality. Consequently, Admetech launched the Prostate Cancer Equity Program in Massachusetts in collaboration with Mass General Brigham, UMass, and other clinical institutions, with the mission to save lives and deliver high-quality care to all. Supporting organizations include Latino Health Insurance Program and multiple NACP branches located across the state. Any Massachusetts man age 40 and older can participate. Our priority focus is on Black, Hispanic, and Latino men who are at higher risk of prostate cancer, delayed diagnosis, poor quality care, and death. Our goal is to expedite access to leading experts who use the most advanced approaches to screening, diagnosis, and treatment available today, and to support men every step of their medical journey. This program helps men to find an expert for the initial or a second opinion, in-person or virtual visits. We strongly believe that our prostate cancer equity program, integrated with our large-scale public awareness campaign, has been placing Massachusetts in a strong position to become the first state in our country to eliminate health disparities. Experts of the Prostate Cancer Equity Program can address any questions about prostate health, from assessing an individual healthy man's personal risk of cancer, to informing men about all available options before and after screening, biopsies, and treatment. We are committed to supporting men during every step of their medical journey to ensure that no man is left behind or struggling alone. To achieve this goal, we created a streamlined VIP-style process of patient referral and care, reflecting how doctors involved in this program take care of their families and friends. This process consists of 3 components. 1, Admetech Foundation's team members collect basic information and match individual patients' needs with the appropriate state's experts for clinical care. 2, a clinical organization designates a patient navigator to expedite a medical visit and related needs, including scheduling, registration, transportation, any insurance and financial assistance if needed. 3, if an expert recommends any next steps, Admetech's team and patient navigator work with men on the appropriate follow-up, such as testing or treatment. I'd like to share with you a few recent examples of how Prostate Cancer Equity Program has been making a difference. This is a case of a Black man with a history of prostate cancer who is currently being treated. On May 15, his doctor informed him that his scheduled treatment could not be provided due to problems with the insurance coverage. He got upset and shared his situation with Representative Bud Williams and a leader of the Men of Color Health Awareness Program, MOCA, our community partner in Springfield, who referred him to us. On the late afternoon of May 26, right before the Memorial Weekend, he contacted us and appealed for help. Our primary goal was to restore his treatment as soon as possible, and we immediately reached out to Dr. Mitchell Sokolov and his team at UMass and secured their support. On May 30th, right after Memorial Day, UMass Urology provided guidance to this man how to address his insurance. By Friday the same week, on June 2nd, the insurance issue has been resolved, and the appointment with Dr. Sokolov was scheduled at the earliest opportunity in early July to resume his treatment. The following Monday, on June 5, a MOCA leader heard about what happened and asked for a second opinion for his own urologic health issue, and received an appointment with a leading urologic expert within a few days of his request. This is a story of a Black man in his mid-50s who was referred to us in mid-May by Cambridge NAACP. This man was recently diagnosed with prostate cancer. He got alarmed when his urologist informed him that the best care will not be available to him due to his limited insurance. We connected him right away with the patient navigator at the Mass General Brigham. She obtained a referral from his primary care physician and secured approval from his insurance. 3 weeks later, by June 6, this man saw Dr. Adam Feldman, a leading clinical expert and one of our featured physicians. Dr. Feldman described various treatment options, but recommended curative surgery, which was performed in mid-August. Emma Coyer serves as a manager of the Prostate Cancer Equity Program. Emma is assisted by Erin Roberts, program coordinator, Greg McClay, a patient educator, and other members of the Admetech Foundation's team. When you come to us, Emma will work with you, our team, Mass General Brigham, UMass, and other clinical partners to expedite medical visits and address any needs you may have. Our team may not be able to right every social wrong that cannot be resolved by federal or state government, or provide perfect solutions for every man. And yet, we are committed to doing our best and making sure men are not left behind or struggling alone. If you have any questions about our program or need assistance, please contact Emma by phone, 617-523-3535, or by email, coordinator@admetechfoundation.org. Thank you for your attention. Our next speaker is Dr. Kwok Dinh Trinh, Section Chief of Urology, Brigham and Women's Faulkner Hospital, co-director of Dana-Farber Brigham and Women's Prostate Cancer Program, and Associate Professor of Surgery at Harvard Medical School. Dr. Trinh is one of the key partners for us in Prostate Cancer Equity Program.
Hi, my name is Kwok Trinh. I'm the Chief of Urology at Brigham Women's Faulkner Hospital. Today, I will talk about our prostate cancer outreach clinic at Mass General Brigham, and specifically our collaborative efforts with the Admetech Foundation to reduce prostate cancer disparities in New England, and specifically the great state of Massachusetts. To understand the framework of our outreach efforts, it's important to understand 3 considerations. The first one is that health systems, especially Mass General Brigham, need to play a role in providing population health for all and emphasizing the all. Number 2 is that minorities, as we call them, will soon constitute greater than 50% of the US population. And as the demographics of the population we serve changes, we as a health system also have to change. And the third consideration, most important to why we are tackling prostate cancer, is that prostate cancer disproportionately affects Black men. Mortality is more than 2-fold higher compared to white men. But we also think that access to care is the main, if not a very important driver of those differences. So let me illustrate that point with a number of studies that we have been involved in. For one, in this study, which the Prostate Cancer Foundation named one of the most provocative studies of that year, is that yes, there is a huge gap in mortality and outcomes between Black and white men. But as you account for other factors, including access to care, where you got access to care, did you get treatment or not, and how bad was your cancer at presentation, those differences go away to a point where in some circumstances, Black men actually may be doing better. And this was demonstrated again and again in other studies using other registries, but also prospective trial data that was accumulated in specific circumstances where, again, Black men actually do better than white men when all these other differences are accounted for. But then you could say, well, it doesn't matter too much because everybody gets good care in the state of Massachusetts. But unfortunately, that is not true. In this study that we conducted in association with the Massachusetts Department of Public Health, we found that Black men were 22% less likely to receive treatment for prostate cancer. And this is among men who we felt strongly should be getting treatment. Other pieces of evidence comes from the great military health system. And as we know, in the military health system, if you are a service member or a member of the family of that service member, you will receive care regardless of your race and where you live. And what we found in looking at data in the military health system is that those so-called disparities in prostate cancer, they actually go away and everybody has similar outcomes. And this is not just true for prostate cancer, it's actually true for other conditions, including colon cancer. And then finally, in this study that we published recently, we found that there's structural differences in outcomes between hospital systems serving health disparities populations. And these are hospitals that predominantly treat, for example, minority populations or uninsured and Medicaid populations. And those differences include the receipt of treatment, how fast treatment is delivered, and unfortunately also outcomes of survival after treatment. And this is even when you adjust and account for things such as race, there are differences in such hospitals compared to hospitals that don't predominantly treat a minority population or a population of uninsured and Medicaid patients. So armed with that data, we did a stakeholder analysis, and this was supported by a grant from the American Cancer Society. And we talked to 80 grassroots organizations, physician executives, physicians, nurse navigators, payers, and tried to understand what are the drivers of access to care disparities in prostate cancer in Massachusetts. And a number of very important themes came along. Some of them include the fact that minority men don't necessarily trust these large healthcare systems that are predominantly taking care of, let's say, a suburban affluent population. There's also the thought that physicians increasingly recognize that there is an issue, but they don't feel adequately supported to tackle the problem. So this is where the Mass General Brigham Prostate Cancer Outreach came about. This is an initiative led by myself and Adam Feldman, who is my counterpart at the Mass General Hospital. And the idea here is to offer high quality, accessible, and affordable. To deliver on this promise, a number of different initiatives were done. And one of them is the initiative that is very successful and has been done with the Admetech Foundation. And this is the Prostate Cancer Equity Program, High Quality Care for All. So as part of this initiative, we have done a number of patient engagement events where we teamed up with Admetech and went to grassroots communities to talk about prostate cancer, but also other things, including men's health, COVID-19, and things that would be of interest to minority populations. And through that program, we have provided second opinions for a number of minority men looking at things ranging from, should I be getting prostate cancer screening, but also, is this the right treatment for me, given that I have prostate cancer? At the center of this initiative, which has been extremely successful, is to have a community navigator between the patient and the system. Because as we know, everything can be very complicated And that ranges from, is the healthcare coverage adequate, access to transportation, et cetera, et cetera. And our community healthcare worker has made sure that these patients got the care that they needed and that they deserved. A number of metrics would ideally be measured as part of such an initiative, and that includes the number of referrals, but that also includes the receipt of appropriate and timely care, patient experience, outcomes, and ultimately cost of care associated with the care of individuals who are referred through this program. We are also proud to say that research is a monumental part of our initiative, and a number of grants have been successfully been funded by different mechanisms, including the Department of Defense, to study, for example, transportation barriers for underserved populations, and again, within the context of the Mass General Brigham Prostate Cancer Outreach Clinic. Most recently, we have been featured in a number of media and local outlets, and this includes the DEI Town Hall, which was led by our president at Brigham and Women's Hospital, Dr. Robert Higgins, for example. This includes also a number of events. And as you can see on the right here, Mayor Wu was present at one of our recent outreach events that was held as part of a large event on the Mass General side. And also in the Boston Globe, our efforts were featured and we were able to talk a little bit about this initiative and the early successes of our program. So the early results of this program is that the Prostate Cancer Outreach Clinic, in collaboration with Admetech, has established a number of consultations. We have seen an increased number of referrals, an increased diagnoses of prostate cancer in a number of minority populations. And ultimately, we will see in the long term if we have been successful in making a difference in prostate cancer disparities. Just to finish, I do want to highlight the difficulties of and the challenges of health equity, because as much of energy and efforts are made by community health workers, by Admetech, by our leadership, it is still difficult to achieve equity. And for example, in the case of this patient who was initially seen in 2017 for an elevated PSA, even today, we have yet to diagnose his prostate cancer for a number of reasons, including how difficult it has been to reach this patient, more than 18 documented phone calls, but more importantly, really highlights the challenges of equity and how much effort we need to make to deliver equitable care for all. So in conclusion, this outlines our efforts to deliver better prostate cancer care for all. More importantly, I tried to highlight the importance of access to care, and that we hope that by providing better access to care through outreach efforts with Admetech, eventually we will decrease prostate cancer mortality in New England and specifically in Massachusetts. Thank you for your time.
Thank you so much, Dr. Trink, for all your work. I also want to acknowledge physicians present here today who are our partners in Prostate Cancer Equity Program. Dr. Trink, Dr. Sokolov from UMass, Dr. Vason from Beth Israel System, who grant appointments to the patients we refer to them within several days to several weeks. Normally, I believe patients need to wait 4 to 6 months for these appointments. We are very grateful. I also want to highlight what Dr. Trink said about the critical importance of infrastructure of support for Black and Hispanic men to go see doctor and then to follow through on medical recommendations. For example, a patient who was featured by Stat Medical News and Boston Globe very extensively in the article mentioned by Kwok, did not come to us, would not have come to us, to our program, if I did not ask Steve Bernard, former president of Brockton NAACP, to talk to this patient who expressed his frustration during one of our Zoom events. And it is conversation between trusted community leader, such as Steve Bernard, that resulted in this man coming to us into the program. So our collaboration with trusted community leaders, trusted organization is absolutely critical in making sure that men will get the best care medicine can offer today. Our next speaker is Dr. Sean Wason. He's a faculty member in the Division of Urology and associated physician, Harvard Medical Faculty Milta Center for Specialty Care, and Needham Urology Associates, Beth Israel Deaconess Medical Center, Beth Israel Leahy Health, Harvard Medical School. Dr. Wason will review advances in screening and diagnosis. Dr. Wason is one of our very generous physicians who volunteers his time for prostate cancer awareness and patient care. Sean, please.
My name is Sean Wason, and I'm a faculty member in the Division of Urology at Beth Israel Deaconess Medical Center. I primarily work out of Milton and Needham hospitals, and I'm a part-time lecturer at Harvard Medical School. I was asked to give a talk on advances in the screening and diagnosis of prostate cancer. I have no disclosures related to this talk. We all may know someone that's been affected by prostate cancer. For me, it was my grandfather, Ernest Wason, who grew up in the sunny island of Barbados, the easternmost Caribbean island. I dedicate this talk to him. The objectives of my talk are to review the goals of screening. Who do we screen? When do we screen? How do we make the diagnosis? And how are we using imaging and biomarkers to screen our patients? Typical patient that may present to me in my office for prostate cancer screening. He's a middle-aged male. He has a strong family history of prostate cancer. Notably, his grandfather died of metastatic prostate cancer, and he has a brother who was recently diagnosed with localized prostate cancer and is undergoing treatment. He has no significant voiding symptoms. He feels well. He works out frequently. He does have well-controlled hypertension, and he takes medications for this and a statin for his elevated cholesterol. He drinks alcohol occasionally. He doesn't smoke. He's married, and his erections are normal. He was noted to have a relatively normal digital rectal exam that was round, smooth, slightly enlarged, but his PSA was 4.5 nanograms per milliliter. I like to review the prostate anatomy with patients. The prostate is typically the size of a walnut, measures about 30 grams, and is part of the urethral channel. It's tucked in between the bladder and the rectum, and the backside of the prostate can be palpated by performing a digital rectal exam. The function is a reproductive organ, and it contributes to semen. What we do know is that prostate cancer is common. It affects 1 in 8 men in the United States. If detected early, the 5-year survival rate is nearly 100%. The goals with prostate cancer screening are to minimize the detection of non-life-threatening cancers and maximize the detection of intermediate and high-grade cancers, as well as decrease the unneeded biopsies and treatment. As established by the American Urologic Association on the early detection of prostate cancer. What we mean by early detection is screening, and both imply detection of a disease at an early pre-symptomatic stage when a man would have no other reason to seek medical care. The panel recommends against PSA screening in men less than the age of 40. In this age group, there is a low prevalence of clinically detectable prostate cancer. The panel also does not recommend routine screening in men over the age of 70, unless they are in excellent health and they may benefit from screening. The panel strongly recommends shared decision-making for men in between the ages of 55 and 69 with either their primary care physician or urologist, and then proceeding with screening based on a man's values and preferences. How do we find prostate cancer? The two most common ways are a blood test measuring PSA or prostate-specific antigen, as well as a digital rectal exam. Screening is best performed when these two are taken in combination. Typically, PSA and digital rectal exam are done annually for screening, but this does not tell you if someone has prostate cancer. You need a prostate biopsy in order to make the diagnosis. PSA stands for prostatic-specific antigen. It's a protein in the semen that liquefies the ejaculate. It circulates in the blood of all men with intact prostates. The good news is PSA is only made by the prostate. However, prostate levels can be elevated for several reasons, such as inflammation, trauma, or natural enlargement as men age. I think a lot of men need to know, what is your PSA and what is the trend? What is the velocity? How quickly is it rising? One of the earliest known biomarkers used in urology. It's used in several phases of the disease, including screening, diagnosis, after local treatment, in advanced as well as metastatic disease. In regards to PSA screening, from a urologist's perspective, most would agree that mass screening is in the past. PSA does have several limitations. It's not a definitive test for prostate cancer. Shared decision-making is important. High-risk patients, such as those with first-degree relatives and family members, should be considered for screening. Age and comorbidities will often dictate who gets screened, which is also dictated by primary care providers. Who gets biopsied and diagnosed is often dictated by urologists. The National Comprehensive Cancer Center also has their guidelines on the early detection of prostate cancer. If a PSA is less than 1 nanogram per milliliter and there is a normal digital rectal exam, repeat testing can occur at longer intervals. If a PSA is in between 1 and 3 with a normal digital rectal exam, repeat testing should occur at 1 to 2 year intervals. If a PSA is greater than 3 or there's a suspicious nodule on digital rectal exam, the PSA should be repeated and this patient referred for possible biopsy. In these patients, we would consider the use of multiparametric MRI as well as biomarkers. If there remains a high suspicion for prostate cancer, these patients should undergo prostate needle biopsy. If there's a low suspicion for prostate cancer, the PSA and digital rectal exam can be repeated at a shorter interval. In my practice, I often use transabdominal ultrasounds to determine the size of the patient's prostate. By taking the PSA divided by the prostate size, we can determine the PSA density. The denser the prostate is, the more concern there is for prostate cancer. Biomarkers available for risk stratification in patients with suspected or known prostate cancer. Biomarkers are biologic molecules typically found in blood, urine, or tissue that can be used as a marker of normal or abnormal processes within the body. Biomarkers can be used in all aspects of patient care. It can be done before a biopsy, prior to repeat prostate biopsy, after biopsy, or post-treatment. Biomarkers should, however, not be routinely used in all patients. We use SelectMDx, which is a urine-based biomarker in my practice. I will use this for patients that have had a negative prostate biopsy in the past. Those patients with a very large prostate with a smaller concern for prostate cancer, and those patients that may be in the gray zone or hesitant to proceed with prostate biopsy. The assay looks for 2 genes, HOXC6 and DLX1, that have been shown to be associated with prostate cancer. Findings associated with the digital rectal exam, the PSA, the patient's age, and the prostate size are combined into a report that tells us the likelihood of finding prostate cancer upon biopsy, as well as, more importantly, the likelihood of detecting a clinically significant prostate cancer, which is considered a Gleason 7 or greater. I will also typically use multiparametric MRI frequently in my practice. In patients considering a prostate biopsy, all patients will undergo a multiparametric MRI, which stands for magnetic resonance imaging. There are several sequences performed in the MRI, and we can evaluate the MRI for suspicious areas within the prostate if there is evidence of extracapsular extension, seminal vesicle involvement, lymph node involvement, or possible bony metastasis. The radiologist will give us a score, PIRAD score, from 1 to 5. And I think it's extremely important for men to know, what does my MRI show? Does it show any PIRADs 4 or 5 lesions? And where are the lesions? Another imaging modality that is currently being employed is microultrasound. This is a high-resolution ultrasound probe that provides real-time images similar to a standard transrectal ultrasound. This can be used in both the initial biopsy phase and the surveillance phase on patients diagnosed with prostate cancer. The images provided by microultrasound are far superior and can provide detailed local anatomy. It also has a very similar scoring system to the PIRADS system called Primus. The higher the number on the Primus score, the higher likelihood of finding clinically significant prostate cancer. Prostate biopsy is typically performed transrectally, and the goal is to sample the peripheral zone of the prostate. On average, 12 cores are taken, 6 on either side, in the peripheral zone of the prostate. The prostate biopsy will tell us, is there prostate cancer or not? What is the Gleason grade, which is the aggressiveness of the prostate cancer? Gleason 6 prostate cancers are the least aggressive, whereas Gleason 10 prostate cancers are the most aggressive. The prostate biopsy also estimates the volume of the cancer, the number of cores involved, what is the location, and if there is perineural invasion, which is a poor prognostic indicator. There are 2 standard ways to perform a prostate biopsy. One is via the transperineal, and the other is via the transrectal route. Both are typically performed in the office, under ultrasound guidance, by a urologist. The added benefit of performing the transperineal biopsy is that anterior aspect of the prostate is more easily sampled. There may also be a slight decrease in the risk of infection via the transperineal route, although recent data is questioning this. Multiparametric MRI ultrasound fusion is a technique used to sample lesions noted on MRI. After the MRI is complete, the radiologist will encircle the lesion on the MRI, and then these images can be fused in real time to a standard transrectal or perineal ultrasound to ensure that the lesions that are noted on MRI are sampled. As prostate cancer can be found 15 to 20% of the time in other areas of the prostate without a lesion, usually the fusion-guided biopsy are also performed with the standard 12-core needle biopsy. After the prostate is sampled, the cores are all sent to a pathologist for evaluation and are given a Gleason grade, which ranges from 6 to 10, 10 being more aggressive. Patient needs to know, what is my current Gleason score? Once we know the Gleason score, the number of cores involved, the PSA, the digital rectal exam finding, the patients are given a risk category ranging from very low, low, intermediate, high, and very high risk. This will determine the extent at which imaging studies need to be performed for evaluation of disease outside of the prostate. In patients with low and favorable intermediate risk disease, genomic biomarkers can be performed on tissue removed at the time of biopsy. This will determine the biologic aggressiveness of the prostate cancer. This is useful for patients considering active surveillance. In patients found to have unfavorable intermediate risk, high risk, and very high risk disease should undergo additional imaging to ensure that there's no metastatic disease or disease outside of the prostate. Traditional imaging includes CT scan of the abdomen and pelvis, as well as a bone scan. Although CT and bone scan are still widely being used for imaging, slowly this is being supplanted by a more sensitive test called PSMA PET scan. PSMA stands for prostate-specific membrane antigen. This is a protein found on the surface of most prostate cancer cells. A radio-labeled pharmaceutical agent is tagged to PSMA. The whole body is scanned, and this will easily identify areas outside of the prostate where there may be prostate cancer metastasis. After a diagnosis of prostate cancer, many men will ask, how can I be proactive in my fight against prostate cancer? One of the fathers of prostate cancer treatment is Professor Laurie Klotz from the University of Toronto. He recommends smoking cessation, consider a low-dose statin, vitamin D supplementation, as well as metformin. In summary, prostate cancer is common and its aggressiveness is quite variable. Earlier detection is favorable and can lead to a cure a lot of the time. Our goal with prostate cancer screening is to maximize detection of intermediate, high, and lethal cancers, minimize the detection of non-life-threatening cancers. We can do this with improved imaging and genomics, which can improve risk stratification. This has also allowed urologists and patients to be more comfortable with active surveillance. Thank you for your attention.
Thank you to Dr. Wason for this presentation. Again, it is my pleasure to introduce our next speaker, Dr. Mitchell Sokolov, Professor and Chairman of Urology, University of Massachusetts, School of Medicine. Dr. Sokolov will review recent advances in treatment. Mitch, please.
Good morning. I'm Dr. Mitchell Sokolov. I am Professor and Chair of the Department of Urology at the University of Massachusetts Chan Medical School, and I am Chief of Urology at UMass Memorial Medical Center. It is a pleasure to be here today to present at Prostate Cancer Awareness Day, and I wish to thank Dr. Stern for inviting me to participate. The underlying goal of cancer therapeutics is straightforward: to eliminate cancer and cancer-related symptoms, to improve survival and longevity, and to minimize the side effects and toxicities from treatment. The current environment for prostate cancer management is robust. Treatment options continue to improve. We have more options, and these choices of treatment are getting more precise and efficacious. While the effectiveness of our therapies progresses, so does our ability to mitigate the side effects of treatment. And perhaps most importantly, access to prostate cancer care for men continues to expand across the Commonwealth. Prostate cancer management begins with accurate diagnosis. We want to target the correct patient population. We want to provide a panel of screening tests that best determine who is at risk for significant disease. And we want to utilize precision diagnostics, combining laboratory, radiologic, pathologic, and molecular tests. Men from Africa, including African, Afro-Caribbean, and African American men, have a high risk of prostate cancer. So do men who have a strong family history of prostate cancer. These are our top target populations. In terms of screening and diagnostics, it all begins with a PSA blood test and digital rectal exam. Now we move forward with multiparametric MRI, perhaps other genetic tests, and finally to an MR-guided fusion biopsy for the most accurate determination of cancer. The approach to management also requires adequate stratification. We wish to determine who will benefit from treatment and how aggressive that treatment needs to be. It begins with surveillance and observation. Not all prostate cancers need to be treated. Many men can be monitored and observed. If a man has a small focus of prostate cancer in the prostate, sometimes we can use focal therapy such as HIFU or TULSA to target just those regions of disease and leave the remainder of the prostate untouched, and therefore minimizing side effects. Radical localized treatments include surgery and radiation. Both of these improved year to year. We now have single port robotic surgery. There's the new Da Vinci 5 robot, which I was able to test drive earlier this year. In terms of radiation, we're using stronger beams with less duration of treatment, less side effects. Both of these treatments, surgery and radiation, continue to improve. When one has systemic disease or metastatic disease, we have a host of new agents that can interfere with different growth factors, androgens, and target tumor deposits with destructive agents. All of this is improving the outcome for men with prostate cancer. Most excitingly is the development of advanced imaging. PSMA PET imaging, which has been around for several years, can provide an additional benefit to the initial diagnosis. It can improve the staging of disease and is extremely powerful in monitoring men either with cancer or who have had treatment for prostate cancer. Central Massachusetts has a high number of expatriate African and Afro-Caribbean communities, let alone African-born American populations. Immigrations from countries with the highest incidence of prostate cancer globally results in a high incidence of prostate cancer in our community. These are mostly underserved populations. Access to care is challenged by social and political determinants of health, and awareness and education about prostate cancer can be lacking. Worcester County has been ground zero for several years. The incidence of mortality tend to be highest in this county, although this is slowly shifting westward. The goal is to improve education and access, awareness and education programs and initiatives to target these at-risk populations, and enabling underserved populations access to state-of-the-art care. The Prostate Cancer Equity Program is a network of prostate cancer centers of excellence. It provides state-of-the-art high-quality diagnostics and therapeutics. There are mechanisms for men in underserved populations to gain access to care at these institutions, and there's data collection and evaluation to provide for ongoing system enhancements and improvements. This is critical and vital to improving the access and treatment for prostate cancer care for men in the Commonwealth. At the University of Massachusetts and at UMass Memorial, we are taking this one step further. Our outreach program includes advanced identification of at-risk men, working with our religious, cultural, and health clinic community partners, using digital medicine to mine our medical records, predictive modeling to identify men within our local communities who might have risk for prostate cancer. We then provide multiple educational activities, lectures and conferences to target patients and providers. We have developed multi-language and multicultural educational activities, and we are also creating a library of multimedia, culturally sensitive, audience-inclusive educational materials, including handouts, webinars, and videos. Once a man is diagnosed, we're using digital medicine monitoring of our medical records, predictive modeling through the course of management to make sure they are staying compliant with the treatments and they are receiving the best treatment possible. We're developing a virtual oncology navigator to help men and their families navigate the system, and we utilize the MyChart function in our electronic medical record to keep in communication. We have patient dashboards to include physician and patient-reported outcome data, and we have continuing education programs to stay on top of our patients and providers to make sure they are receiving the most up-to-date and current treatment, management, and information. Our goal is to expand beyond Worcester County. There are several counties to the west of us where prostate cancer incidence is also quite high. This includes Franklin County, Hampshire County, and Hampton County. And our programs are targeting this whole central and western Massachusetts region. In many ways, I was very fortunate when I was diagnosed with prostate cancer myself. As an expert in the field, I knew enough about my strong family history that I could start monitoring myself at an early age. I had knowledge of and access to the most advanced diagnostic assessments. And once diagnosed, I could arrange for state-of-the-art treatment at a center of excellence with a high-volume specialist. Our goal is to provide the same experience to all men in the state of Massachusetts by connecting the best medical resources in the state with effective access and educational initiatives to provide comprehensive prostate cancer care.
Thank you so much, Kwok, Sean, and Mitch, for your outstanding work. There is no doubt in my mind that together, particularly together with you and with leaders of Black and brown communities in Massachusetts, will make Massachusetts the first state to eliminate health disparities in prostate cancer. The next section of our program is men's testimony. They will share with us what their experience was with prostate cancer equity program. The first person to testify is Jose Javier. I've known Jose for well over 10 years. Jose is a prostate cancer advocate, and he came to us for help about 10 years ago.
Hello, everyone. My name is Jose Javier. First, let me begin by thanking Dr. Stern for inviting me here today and being part of this. I'm excited to share with you and grateful to be able to share with you for a few minutes a little bit about my story and my experience with Admetech in the organization. I met Dr. Stern around the fall of 2015. I heard about her from a friend of mine at church, Victor McCann, which I'm grateful for because he was going through the same thing, and he was able to share at church, and I heard his testimony, and I was able to approach him after the service, and we had a great conversation. I was very shy about this subject. I too had a very high count of my PSA exam and had to go in for a biopsy. And I learned from Victor McCain the difference between an MRI biopsy, a guided biopsy, and also what is referred to as a blind biopsy. And those made a difference in my life. And I was able to meet Dr. Stern through this process. And I was able to go in, get a MRI guided biopsy at the NIH and so forth. And it was a fantastic experience for me. So for me, part of the takeaway when it comes to this is really to be aware. Be aware, learn about the processes, learn what's available out there, what programs are available for you, what are the best tools to do the job. A very important thing is to share it. That's what I learned from my friend Victor, is to share it at church, share it with other people so they can learn as well. And because in our community, especially in the Black American community and the Latino community, it's a subject that is not often spoke about. When we talk about our private parts and speaking about the prostate, it's not always a conversation that is too welcoming in our community. So I would encourage people to share it, to learn. And as Governor Baker always says, get tested. You know, it's easy to get tested. Ask your doctor for a test and be aware and that there are solutions out there. We have great referrals, we have great doctors, and contact the leadership, the people at Admetech, and they're able to guide you in the right direction. Thank you. Please allow me to say a few words in Spanish. Para nuestra comunidad en español, este tema de cáncer en la próstata es un tema súper serio, muy serio, y es un tema que nos impacta a nuestra comunidad significantemente. Yo le quería decir a ustedes que, por favor, hablen con su médico si sienten algún síntoma, si están teniendo problemas orinando, cualquier irregularidades. Hablen con su médico, no tengan miedo de conversar con su médico, hablen con personas que tienen experiencias similares y eso le puede salvar su vida. Lo más importante es hacerse un examen PSA. Por favor, estudienlo bien y aprendan más. Gracias.
Thank you, Jose, for your testimony. We greatly appreciate your commitment for all of the years. A couple more acknowledgements before moving on to our next speaker. I want to acknowledge Representative Fluker Oakley, Representative Robertson, and Representative Phillips. We greatly appreciate you for being here. Along with, we want to thank the Massachusetts State Senate for just passing the prostate cancer resolution that was read earlier today, earlier in the program by Senator Brownsberger and Representative Cassidy. Our next speaker is giving another testimony.
Hi, everyone. I'm so glad to be here. My name is Ronald Roberts, and I'm just so glad to be included in this presentation. I have known about Admetech, and I met Dr. Stern years ago, and I would have never thought that I would be needing them so much last August when I was diagnosed on July 4th with prostate cancer that had spread to about 3 organs and lymph nodes, and I was in really bad shape. When I contacted Admetech, I ended up talking to Dr. Stern later on, and she directed me in the right direction. I ended up at Dana-Farber and jumping around to Brigham and Women's. I'm just fortunate. I consider myself fortunate to live. The medical help is available if you know where to go. It really paid off for me. I'm doing pretty well after going through the MRIs and using the advanced equipment was provided to me. But through the direction of Admetech, I got to the right places. It takes a lot of willpower and positive thinking to do and go through what I did. I ended up driving over 3,600 miles, and that was after I had a driver that used to take me when I was weak. When you add the radiation, chemo in, 34 more appointments, it comes out to a lot of appointments, and I made every one. It was nice to know there was always somebody in the background that could help out if I had I needed an opinion or tried to make a decision, and that was Admetech. I'm glad that we're doing this presentation, and she's done it before, but I think this one's going to be larger, and to bring people like myself that are patients, been exposed to the cancer, and survivors and people from the medical field and politicians. It's something that's badly needed for the minority community. We have the knowledge there. Things have changed a lot in terms of prostate cancer for the better. I'm taking a drug that's only 3 years old that has excellent results, but you got to know where it is and you got to be guided in the right direction. It's kind of frustrating that there's so many people out there that do have it and are not getting the help or not getting the proper help. I had put it off for years. I knew back in 2010 when I had Lyme disease, relapsing polychondritis, and babesiosis, and I forgot what else, all at the same time. I tried to treat the cancer back then with chemo, and it just got worse, and had a lot of bad experiences with doctors with the Lyme disease, so I just put it on the back burner. And I didn't even feel anything up until the few months before I was diagnosed, and that was I couldn't hold food down too well. Fortunately, a lot has changed since 2010-11 when I was treated. There's a lot out there, a lot of new advanced machinery that can help with MRIs and radiation. We're fortunate in Massachusetts to have it available, and especially the Boston area. Without Admetech to guide you and be a resource, it's just so crucial if you need it, because sometimes you got to make a decision as to what the treatment is, and everybody's different. The reason I waited so long is trust, and that's a big thing. I have met other patients that have had mistakes or things didn't go right, and finally they got the right help, but they had to go through just trials and waiting and insurance problems. And that's something that could be avoided or hopefully streamlined. And that's what Admetech is there for, if you catch it early. And it is so important to get tested early and continue the testing. The primary doctors should know more about Admetech. And one other thing, with the testing that I did do and all that I went through, what helped me, if nothing else, but mentally, was getting a DNA test. My father had passed from prostate cancer at about age 84. So I always thought it was hereditary. And through the DNA testing, I found it wasn't. But I do have the gene that causes colon cancer. And around December, I got a notice from, I think it was Dana-Farber, that that gene could possibly cause prostate cancer. So they're looking into that. And DNA testing also helps for alternative treatments. So it's good to do. And it's also, it helps my nephew and all know that they got to get tested and what to look for. The good thing about all this is there's a lot of research and things are changing fast. So even if you are sick, if you can hold in there, there's more on the way that could possibly help. And once again, what I did this past year, I couldn't do back in 2011. It wasn't available. And the idea of research and studies, and you do get a lot of notices for that. Probably scares people too, because we think back to the Tuskegee study. I'm probably going to benefit from one of the studies they're going to do on me, and that is exercise in relation to the hormone therapy and the heart. So I'm looking forward to that in June. It's quite a study, quite a bit of exercise. I'm going to end it there.
Thank you, Ronald, for your testimony. We greatly appreciate it. I have the honor of introducing this next speaker, Ken Reeves, President, Cambridge NAACP, a prostate cancer survivor who was referred to the Prostate Cancer Equity Program by Juan Cofield, who was president of the NAACP New England Area Conference at the time. President Reeves.
Wheels of government are churning to understand and grapple with this very real health crisis, particularly in communities of color. But I also want to say that men of color in Massachusetts have been on the page of health disparities, particularly I can speak to Cambridge, where I'm also the former mayor, where we have two efforts, one, a Men of Color Health Initiative and Task Force, and also we have our annual Hoops and Health Basketball Tournament, which is a health-based tournament where all those who participate have to get involved in health-related activities to participate. And we've actually been able to get to thousands of men of color with these vehicles. And both of those programs are nearly 30 years old. So we're so happy to have Admetech Foundation now to join to amplify our ability to better serve our population of men. And who better to lead that than people who have actually had the problem, who are both men of color and who have been touched by prostate cancer, which is my story. So thank you for mentioning my friend Juan Cofield, who, you know, I was diagnosed with prostate cancer and I went through the CyberKnife treatment and the prostate cancer seemed to abate. But then after a couple years, my PSA kept going up and up and up. And so I'm going to a meeting and it's 10 and then it's 20 and then it's 30. And I'm having biopsy after biopsy, but no evidence of where this heightened PSA is coming from. And so I finally get a second opinion from a brilliant Asian female physician who essentially told me, I cannot advise you because you have not had the right test. The test you need is called the PSMA PET scan test, and I will get that for you. So I said, well, fine. I'd love to have that test. And this is a better imaging study of the body for where the cancer might be. And after 2 weeks, I called her back and I said, I hope I didn't miss your call, but I'm really waiting to hear when I can get the test. And she says, I must honestly tell you, I can't find anywhere in Massachusetts that has the test. It's very common in Europe, but it's just not approved by the FDA in America. And so it's difficult to find. And so Juan, I'm talking to him about, I'm going everywhere, but this number is going up and we don't know why. And Juan says, sounds like I should refer you to Dr. Stern, my friend, Dr. Stern. I think she may be able to help you. Now, enough could never be said about Dr. Stern and her ability to help men who are having trouble accessing help for prostate cancer question. So I get in touch with Dr. Stern, and she says, well, of course, I will help you. And before I know it, I'm in touch with Sloan Memorial Kettering in New York City, arranging to have the test done there. And I, with her help, and when I say through her help, I don't mean she just made a phone call. With Dr. Stern, the application process was so arduous that by the time you complete the whole application, they call you back and tell you, well, that information is 20 days old. We cannot use 20 days old information. So you have to go back to the beginning. And I had to get Dr. Stern. Now, realize I'm a former mayor, a lawyer, and a very good advocate, but I have to get her on the phone with the secretary to tell her, look, you asked us for this 17 times, and we gave it to you 17 times. So there must be a problem on your end. She's a fierce advocate. If anybody I knew had a prostate issue, I would connect them to Dr. Stern as I had. But I'll land by simply saying that the Admetech program has brought to men of color in Massachusetts Class A, high-class VIP approach to prostate cancer and connection to the premier institutions in ways that only, I would say, the rich have previously been able to be served. So I think that is something important, and I really think our legislature has to fund this because we need this approach because we have the problem worse than anyone else, and we need the best of help to get us out of this bad statistic area and bring us. I'm so pleased to know from Dr. Tran earlier about these reports from the Veterans Hospital situation, which basically say if you have equal access to healthcare, you have the same, if not better, outcomes. That's the Cadillac program and plan we want for the Black and Latino men in Cambridge and throughout the Commonwealth. So pleased to be asked to be a part of this 15th Prostate Awareness Day program, and shout out to Dr. Stern. She's a tremendous leader, and we are part of her followership. Thank you.
Thank you so much. It's very generous, Mr. Reeves. Well, our next section is dedicated to prostate cancer warriors, men who, similarly to Jose, Ronald, and Mr. Reeves, are sharing the stories in order to transform personal experience into public service. Our next speaker is a person who referred Mr. Reeves to us, Juan Caulfield, past president of NAACP New England Area Conference, member, Commission on the Status of African Americans in Massachusetts, and president, Social Justice Foundation. Prostate cancer survivor. Juan, please.
Hello, I'm Juan Cofield. I am pleased to join you today at the 15th Annual Prostate Cancer Awareness Event. My pleasure comes from having worked over many years with Dr. Faye Stern and the Admetech Foundation in advancing prostate cancer awareness through the Massachusetts branches of the NAACP. I continue to work with Admetech Foundation through the Social Justice Foundation, where I serve as president. Dr. Stern continues to do an outstanding job in promoting prostate cancer awareness, early detection of prostate cancer, and more advanced and effective treatments for prostate cancer. I have had a tremendous incentive to work with Dr. Stern because I am a prostate cancer survivor. So is my brother. We both became aware very early and received effective treatment for prostate cancer. My father also had prostate cancer. He was not diagnosed at as early a stage, but he received state-of-the-art treatment at that time. So, with my personal experience, I have been knowledgeable of the importance of prostate cancer awareness. Awareness and early detection greatly enhance less invasive and more effective treatment options. The incidence of prostate cancer is greater in men of color, as many health needs are also greater in these communities. So, the Social Justice Foundation is pleased to work with Admetech Foundation in its prostate cancer awareness program. Prostate cancer is one of the easiest serious health issues to address because one does not have to lose weight or exercise more. The solution is awareness, which leads to early detection, which leads to appropriate treatment. I want to commend the leadership for their budgetary support of prostate cancer awareness under Admetech Foundation's program. Thank you to all who are actively involved in creating and supporting prostate cancer awareness. Have a good day.
Thank you, Juan, for your testimonial. We greatly appreciate it. Introducing our next speaker, Darren Duarte, Director of Communications and spokesperson, Brockton Police Department, and a prostate cancer survivor.
Hi, I'm Darren Duarte, and thank you for giving me the opportunity to speak this once before at an event at Beacon Hill. My story is similar to some and probably also different from a lot of people. And I appreciate the folks at Admetech for putting out the information so that men like me know that we should go and get checked. Initially, I went to a few events that Admetech would have. I wasn't following the recommendations that they put out. What do I mean by that? I'd go to the events thinking, oh, this couldn't happen to me, so I wouldn't go to the doctor and get checked. Next year, same thing. I'd go, didn't go get checked. I think a lot of men do that. A lot of men may not be going to Admetech, but they may hear these stories and not act on. One particular year, I did act on, and thank God I did. My primary care doctor saw my levels, my PSA levels were pretty high. She recommended me to a urologist. I followed that urologist's lead. And at the end of the day, we got a biopsy. And coming to find out, I had an aggressive, very aggressive form of prostate cancer. I went to a surgeon right away. And what my urologist and what my surgeon did not know at the time, whether any of the cancer had gone into my bloodstream yet. They thought that maybe it was confined to the capsule, but the cancer, according to the pathology report, was on the move. So it was a very scary time for me and my family. Luckily, again, tested to see if anything was in my bones or any parts of my body, and that was negative. That was negative. So, but the doctors all agreed, and even I got a second opinion that we should do something fast before it does spread. So therefore, what happened, I then, within 30 days or so, 30 or 45 days from my initial diagnosis, we had surgery. And I had a radical prostatectomy. And the rest basically is history. Rest is history in that I did not need chemo. I did not need radiation. We did act, although I was late going, but I did act and acted in time so that I'm not dealing with this cancer now. One of the things that many of you may know and some who don't, this prostate cancer is a slow-moving disease, but it is for some, not for all. And that's why I think it's imperative that all of us get tested. And more than just get tested, I think we need to take it upon ourselves to also be our own advocate. Look at what your tests are. Discuss it with your doctor. Discuss it with your family. Because initially, I had to push for the biopsy. Because my doctor wasn't really saying. And when I looked at what my PSA scores were, and talking to the folks at Admetech, those levels were pretty high. We were able to get a biopsy and act fast. My surgeon said that if I had left this alone, the way I was going and didn't act on it, he said he wouldn't be surprised that within 3 to 5 years from that time, that I may be dead. So it was a wake-up call. And also, whenever I can, I like to spread the word and tell folks, more than just get tested, pay attention. Because as I would say, it's better safe than sorry. If you talk to your doctor, get the biopsy. And if you need imaging, which Dr. Stern also stresses, do that. Because again, it's better safe than sorry. And it's better to have your life, because it is a disease that can be treated if it's caught in time. Thank you very much.
Thank you so much, Darren, for generously sharing your story like many other men before you during this program. And I want to emphasize what Darren said about early detection of prostate cancer, because it's critical for curing this disease. Our next section of the program is prostate cancer crisis in Black, Hispanic, and Latino men. And the first speaker in this section of the program is Roxanne Cole, President and CEO, Urban League of Eastern Massachusetts. Mr. Hall, please.
My name is Rasan Hall, and I am the President and CEO of the Urban League of Eastern Massachusetts. And we're proud to partner with Admetech and others on this Prostate Cancer Awareness Day. It's so important that we raise awareness about the impacts of prostate cancer, particularly in communities of color and in the Black community especially. With Black men being 2.5 times more likely to die from prostate cancer, it is incumbent upon us to make sure that we raise awareness and tell as many people as possible that this is a disease that can be stopped. Start with your husbands, your brothers, your fathers, your uncles, your nephews, and even your sons. Make sure everyone in your life knows about the need to get screened, to visit your doctor regularly, to make sure that this disease does not continue to have the deadly impact in our community that it has had for generations. I have the privilege of being in community with men who have survived prostate cancer. And the reason I have that privilege is because they took the steps to get screened and to seek treatment early on. Unfortunately, there are many in our community that don't have that same privilege because someone in their life lacked information or access to resources. And that's what today is about, making sure that people have information and knowledge. And so as we stand with Admetech and others on this Prostate Cancer Awareness Day, I implore you to partner with local community advocacy organizations like the Urban League, like Admetech, and like many others to share information and encourage the people in your life to make sure that they are spreading information about prostate cancer, the ways to screen for it, and the ways to treat it. Thank you for your attendance and participation today, and we will win this fight.
Thank you, Mr. Hall. I'm proud to introduce our next speaker, Zane Croup, Secretary NAACP New England Area Conference and the immediate past president of the Mystic Valley NAACP. Zane.
Hello all. My name is Zane Croup. I'm the current secretary of the New England Area Conference of the NAACP. Also, I am the immediate past president of the Mystic Valley Area Branch of the NAACP. The Mystic Valley Area Branch of the NAACP covers various suburbs and cities that are just north of Boston, such as Medford, Arlington, Malden, Everett, Winchester, and Woburn. The Mystic Valley Area Branch of the NAACP supports this fight against prostate cancer. And in honor of the annual Prostate Cancer Day, I would like to stress the importance of early detection. I would like to stress the importance of Black and Latino men getting tested for prostate cancer if they're in the appropriate age range. I would like to stress the importance of spreading awareness. Cancer sucks, but this is a cancer that we can beat if we catch it early. I urge everyone to reduce the impact of prostate cancer in our communities by spreading knowledge, spreading awareness, catching this early. Men getting tested if you're over 40. This is a fight we can win and a fight we can beat if you catch this cancer and fight it early. God willingly, this is not one of the worst types of cancer that can kill you. The survival rate is very, very high if we catch it early and if we're aware of this cancer. I urge everyone to rely on the Admetech Foundation to help support in the fight against this cancer.
And thank you so much, Zane. And then I cannot thank you enough for all of your support. As in the past, as a president of Mystic Valley NAACP, and right now as a secretary of NAACP New England Area Conference. Our next speaker is Dr. Guy Fish, CEO, Greater Lawrence Family Health Center.
This is Dr. Guy Fish, President and CEO of the Greater Lawrence Family Health Center. I'm pleased to be speaking with you today at the Admetech conference with respect to prostate cancer, a topic which is near and dear to my heart. I have a few simple messages to communicate to you this morning. The first is that prostate cancer is something we should all take seriously. But if you have a father, husband, son, uncle, then you also need to take prostate cancer seriously. Why? Because, let's face it, men have a hard time taking their own health seriously, and we need a little help. So, ladies, please get in the game with us. Number two, what is prostate cancer and why should we talk about it? Well, prostate cancer is among the leading causes of death for men in these United States, and it particularly is hard on Black and brown communities. The number one cause of death for men, well, it depends on how old you are. For Black and brown men under the age of 50, gun violence is certainly top of the list. But beyond that, we have the usual mortalities around cardiovascular death and cancer, and leading among cancer is prostate cancer in men. So let's take it seriously, because every time that a man dies prematurely of prostate cancer, that's a father, son, uncle who's not around to be at our birthday parties, at our celebration events. So let's make sure that that generational wisdom and wealth and knowledge is passed down to our generations because they're around, not dying prematurely. So what is a prostate, and what does it mean to have prostate cancer? The prostate is a gland that is involved in the men's urological system. It's about the size of a walnut. It sits underneath the bladder, and it provides lubrication for sperm as they usher forth to produce children. Now, that gland is going to be there from the time that a man is born to the time that he dies. And along the way, like most organs in the body, those cells know what they're supposed to do. They're supposed to produce the fluids that I mentioned. They're supposed to reproduce themselves in an orderly way and die off in an orderly way, just as liver cells and kidney cells and heart cells do all the time. But in the prostate gland, there's a possibility of cancer developing. And cancer means that the cells have forgotten who they are. They've forgotten certain rules about not continuing on forever, acting like they're immortal. And when that happens, they grow and grow and grow, and then they make a tumor, which can then seed other parts of the body and into places where it shouldn't be, such as the liver or the lung or the brain. So what we want to do when we are able to is to use the tools and technologies that God has made available to us through human intelligence to detect prostate cancer early. Early detection and prevention are the keys to getting to better outcomes with respect to any cancer. So the good news is that it is actually fairly easy to detect prostate cancer early on. What is that and how do you do that? Well, the first thing you need to do is, again, recognize that you should be checking up on your health with your doctor. So men, let's schedule those doctor's appointments. We know we don't do that, but we really need to get a scheduled doctor's appointment. And in that doctor's appointment, ask them to please check our prostate. Why? Because African-American and brown men have a higher rate of death from prostate cancer. It's not that our biology is different. It's that largely we don't let it become detected until it's too late to do something about it. Most men who have a prostate that is developing a tumor will probably die of other things many, many years later. But some may require surgery because it's moving aggressively or is at risk of spreading. And in that case, there are prostate surgeries which are done mostly robotically these days and minimally invasive. So you don't have to have a big scar like in the past. So what I'm describing is a journey which should engage you in terms of your desire to be here for your children, your grandchildren, your wife and family. It isn't scary. It's just a necessary type of screening that you need to do to be mindful of how you are doing, how your body is doing. We need to take ownership of that. The most important thing of everything that I'm saying is that you need to own this. You need to be an advocate for your own well-being. If your PSA and your prostate exam are going up, you may want to have more specialized testing done. There are new tests that are on the market which are helpful in determining which of these tumors are actually aggressive and which ones are pretty indolent, and you can let them sort of not be bothered. But you really have to be an advocate for your own health. And that's the most important differentiator between the outcomes in Black and brown communities and the majority of population. How aggressive are we being, making those appointments, speaking to the doctors about what we want, and following up on those test results? That's up to you. And it's really up to you to ensure that you're here for your loved ones. So my personal history, my father died of prostate cancer. It was detected a little bit too late for much to be done. He was someone who, like most men, didn't really get his physical exams in on a regular basis and went on to pay the consequences. So I don't want that for you. I just had my annual exam last week. My PSA is in a normal range, thank God. And I will check it again next year. So I hope that when next time we meet, you can tell me that you've done the same. Thank you so much.
Thank you, Dr. Fish, and for your years of partnership as well. Our next speaker is another long-term partner for the Admetech program and the Prostate Cancer Equity Program, is Dr. Milagros Abreu, founder, president, and CEO of the Latino Health Insurance Program. Dr. Abreu.
I'm going to be talking about our prostate cancer awareness and prevention program. We wanted to thank Admetech Foundation, thanks to these fundings and the legislators. These programs have helped us to establish an ongoing sustainable prostate cancer awareness program for Latinx and African American men in Massachusetts. Men enrolled in the program receive the following services: 101 education to discuss the risk to develop prostate cancer. These individuals have clinical encounter with licensed Massachusetts health professionals, LHIP clinicians, These programs are also delivered in multiple languages, have received training from high-skilled professionals to meet the standard of care thanks to Admetech. We provide free PSA testing. This program has reduced disparities in access to healthcare and treatment for these men. We refer these individuals to a specialist based on the results of their testings. They receive appropriate referral also not only for urologists, but other specialists like cardiologists, endocrinologists, and so because many of these men have other conditions. We also provide patient navigator to assist them, not only to them, but their families to apply for medical dental coverage, evidence, nutritional programs, financial assistance, housing, and so on. So these programs are being delivered not only to the men who can be at risk of prostate cancer, but also to family members, their wife, their mothers, and everyone in the household, because the support that they can get from the family members. And also sometimes we as a woman are the one who make strong decisions about our men's health. So we wanted to make sure that they have the support and their understandings of the members in the home. So some of the important aspects of LHIP is our partnership across the state. We deliver these programs in multiple areas in Massachusetts. So this education and awareness has been delivered in Worcester, Framingham, thanks to our collaboration with faith-based organizations and also Board of Health, Housing Development departments, other organizations, and multiple other community members. Our organization has a commitment to prevention. So we believe that by providing strong education and screening access to members from these communities, we can have better health outcomes. We can improve the quality of life, and overall, we can reduce healthcare costs. Not only prostate cancer, our organization is also providing education, assistance, and other services such as diabetes prevention program, breast cancer screening, and cervical cancer screening and education, and also vaccines for children and adults. In our prostate cancer prevention program, many of these individuals have other conditions, and the majority of them were found that they are also diagnosed with hypertension, prediabetes, and other chronic diseases. So our efforts are also to educate them about how they can reduce their risk and to live healthier lives. So just to tell you about our program results from last year, 850 men received PSA screening and counseling about the risk of prostate cancer. 160 from these men received additional evaluation and treatment. 11 from these men were diagnosed with treatable prostate cancer. 200 of these men completed education such as diabetes prevention, diabetes self-management program, because they were found to have these other diseases, and we educate them about how to manage this condition. And they were residents in Massachusetts from the following communities: Metro West, Ashland, Worcester, Milford, and other communities in Massachusetts. We wanted, with your support, to create equitable and accessible communities for all in Massachusetts. I would like to thank to each and every one of you who are attending this program, because with you, we are being able to do all these efforts in collaboration. So thank you so much and have a great day.
Thank you, Dr. Brave, for your testimonial, and we thank you for your many years of your partnership. Introducing another great champion for our efforts, Steve Bernard, immediate past president, Brockton area branch, NAACP, and a great advocate to our prostate cancer act. Steve.
My name is Steve Bernard. I'm a former president of the Brockton area branch of the NAACP. We have partnered with Admetech Foundation since 2015. with an emphasis on Black men of African and Hispanic descent. The disease strikes 1 in 8 American men. Black, including Hispanic men, are 2.5 times more likely to die compared to white men. For 8 years, we have held forums, both in person and virtually, featuring presentations by top urologists from MGH, Brigham and Women's, Beth Israel, Dana-Farber, University of Massachusetts Chan Medical School, Greater Boston Urology, and more. In 2015, Brockton and Plymouth County had the highest mortality rate in the state, due in part to our efforts to encourage and empower men to take care of their prostate health. The mortality rate for prostate cancer in Brockton and Plymouth County is significantly reduced, and the mortality rate for Black men is near parity to that of white men. Some have testified that attending our forums helped to save their lives. We are extremely thankful and grateful to Admetech Foundation, Dr. Faina Stern, and the entire Admetech team for all that they have done, all that they are currently doing, and all that they will do in the future to bring prostate cancer awareness and education to the communities of Massachusetts. There is so much more that Admetech is doing. Allow me to share some talking points about Admetech's Prostate Cancer Equity Program. The program was established by Admetech in collaboration with Mass General Brigham and University of Massachusetts Health Systems, and supported by NAACP, New England Area Conference, and Latino Health Insurance Program. The mission is to save lives and make sure that no man is left behind or struggling alone. Prostate cancer is the most common male malignancy and a leading health disparity. Black, including Hispanic men, are 2.5 times more likely to die compared to white men. The goal of the program is twofold: to expedite men's access to leading experts who can offer the best prostate care available today, and to support men every step of their medical journey, organizing visits to doctors and addressing any concerns related to insurance, transportation, and other issues. Our program empowers each man to make choices in patient care that are right for him. Our participating experts inform men about their best options before and after screening, diagnosis, and treatment. In particular, we would encourage any man age 40 and older to take part in the program if they did not have the screening with PSA blood tests. This test is critical to early detection and saving lives. Any Massachusetts man age 40 and older is welcome to take part. Our priority focus is on Black, Hispanic, and Latino individuals who are at greater risk of delayed diagnosis and poor quality care. Our program expedites visits with experts for initial consultation and a second opinion. It is a natural progression from providing awareness and education about prostate cancer to providing access to best quality care. Admetech is dedicated to closing the disparity gap in prostate cancer care for Black men, including Hispanic men. It is my honor and pleasure to serve as a community coordinator working with the Admetech Foundation. At this time, I'd like to congratulate all that are participating in today's Prostate Cancer Awareness Day, and thank you for this opportunity to participate.
Thank you, Steve, for your many years of support and partnership. Introducing our next speaker is going to be Leona Martin, a member of Brockton Area Branch NAACP and a profound supporter of the Prostate Cancer Act.
My name is Leona Martin, and I am a member of the Health Committee for the Brockton Area NAACP. And I just wanted to talk a little bit today about the Prostate Cancer Equity Program. And I'm speaking for a family member of mine who went through the program and really had a very good experience with that process. Before I talk a little bit about what he told me in his experience, I just wanted to say that this program really is something that I would hope to see across the country. And it's saving lives. If you're able to get men to get second opinions about their prostate health, I just think that it's a wonderful thing. And just having the ability to do that. And I commend the work that Admetech is doing and has done to ensure that this program could get off to a great start. We've had some great success stories of which you'll probably hear, but I just wanted to talk a little bit about my family member who said that his experience with the program, just the ease of navigating to see people. So the comfort of making appointments, the ability to talk to the doctor. He actually spoke to a Dr. Trin, and Dr. Trin gave him so much confidence and just kind of, walked him through everything and spoke in a language that he was able to understand. His follow-up was wonderful. They spoke on the telephone a few times. He explained everything that they were going to do in terms of testing, biopsy, and so forth. And just, explained everything as they were going through the process, because my family member was nervous, as one would expect, but he being Dr. Trin just really gave him the confidence and made him feel comfortable about what he was dealing with. So I think that if anyone is going to take advantage of this program, just knowing that there are caring, brilliant physicians who are part of our PCE program, and they will walk you through everything and again, speak in a language that you can understand. Everyone has a right to get a second opinion if they feel like they need to, because this is a very personal thing and it can be a very scary thing. So if you're dealing with doctors around your prostate health, you just need to be talking to people that you are comfortable with and feel good about. So I just feel like this is, again, a great program, and it's changing lives. As I think about the work that we started doing here in Brockton back in 2015, when we first were introduced to Admetech, and we being the Brockton NAACP, we immediately bonded and felt like we needed to partner. Because at that time, the Plymouth County had one of the highest, I believe, levels of the disease. And as a result of our partnership, we've seen that number or those numbers change immensely. So that now, the education that we've provided within this community has really, truly made a difference. And I just feel like we here, in partnership with Admetech and the Brockton NAACP, we are changing men's lives, one man at a time. The PCE program is wonderful. It's a joy working with Dr. Stern and her team. And I just hope that we're able to continue this partnership for many years to come. Thank you.
Thank you so much, Leona. Steve and Leona, thank you so much for being a part of the core leadership team of Prostate Cancer Equity Program, and we appreciate your commitment and your enthusiasm and your passion for the program. I am particularly grateful to Leona for sharing her personal experience and many other people about Prostate Cancer Equity Program, because it is our mission to transform fears about prostate cancer, concerns, challenges into comfort, confidence, and great outcomes. Before we will adjourn the program, I would like to again share some messages from our sponsors.
Hank's always got his tool belt with him. Now Hank is living with prostate cancer. He still knows how to be handy. And he also knows Once Daily Xtandi. Xtandi treats metastatic prostate cancer that responds to a medical or surgical treatment to lower testosterone. Xtandi is proven to help these men live longer. Xtandi may cause serious side effects, including seizure, a brain condition called PRES, allergic reactions, heart disease that can lead to death, falls, and bone fractures. Stop taking Xtandi and get medical help at once if your face, tongue, lip, or throat start swelling. Tell your doctor at once if you faint, have a seizure, quickly worsening headache, decreased alertness, confusion, vision problems, chest pain or discomfort, or shortness of breath. Xtandi can cause harm to an unborn baby or miscarriage. Most common side effects include muscle and joint pain, feeling unusually tired, hot flashes, constipation, less appetite, diarrhea, high blood pressure, bleeding, falls, fractures, and headache. Nice work, Hank. Ask your doctor about Xtandi.
When it comes to optimizing cancer care, improving the lives of patients through innovative imaging solutions is critical. Blue Earth Diagnostics is empowering the evolution of care for patients with cancer.
Thank you. Our agenda came to a close. I will be adjourning this meeting. But before I do, I would like to thank all the speakers, leaders of legislature, leaders of medicine, Governor Healy, all the patients who shared their stories, community leaders who have been long-time partners, members of the Prostate Cancer Action Council. Thank you very much for your partnership. Thank you so much for your support. Together, we will make Massachusetts the first state to eliminate health disparities in prostate cancer. I would like to wish you a great day. For our audience, thank you for being a part of this event. Everyone, great day. Thank you.